Hello, everyone. I'm Dr. Renee Mehrra. Thank you so much for joining Zoom In with Renee. Today, my guest is Frank Winter. He's from the Center for Medicare and Medicaid Services, and he's a health insurance specialist. Every year, Frank Winter comes on my show to tell us about new developments in Medicare and Medicaid services. This has been for like the last 20 years. We've been doing shows. Let's talk to you, Frank, about 2024 changes. Start with Medicare Part A and Part B. I know in Part B, the premium is almost $10 more than last year. For Part A, which is the hospital stay, there is a $23 increase.
Yes, that's right. There is a slight increase in what we say is the base Medicare Part B premium. So that's the premium that most people with Medicare pay. Some folks will pay more based on their income, and a little increase in terms of the Part A costs as well, going into this new year.
The out-of-pocket prescription drugs expenses, any changes in there?
So one of the big improvements that took effect last year is the cap on 30-day supply of insulin, and that's whether someone receives insulin through Medicare Part D or Medicare Part B. Or a lot of folks receive it through Part D, but some people also receive it through a piece of medical equipment, and then it's paid through Medicare Part B. Either way, it's capped at the $35 for a month's supply. Now, if you are getting your insulin through a Part D plan, you have to make sure that the specific type of insulin that you're taking is covered by that plan. And of course, open enrollment just ended, but we encourage folks to, make the comparison each year on open enrollment during the open enrollment period for Medicare to make sure that their drugs are going to be covered. But that's really a big improvement. One other improvement.
You're talking about protection from high catastrophic costs of name brand drugs?
Yeah, so people who reach what we say is the catastrophic level of drug costs, they're going to not have to pay anymore.
How do you define the catastrophic level?
Well, it's quite a few $1,000s of prescription drug expenditures, but the good news is if you reach that level, unfortunately, in the past, you would have had to pay up to 5% still for your prescription drugs. But now, if you reach that level, you won't have to pay on those, sometimes expensive name brand prescriptions. So that is a big improvement. And that takes effect this year. Next year, there'll be actually a cap on yearly out-of-pocket expenditures under Medicare Part D. So we're also very excited about that taking place in 2025. One other improvement to Part D is for those who, if you get a vaccination through Medicare Part D and it's recommended for you, you can also get that now without cost. So that's been in effect for a little while, but was a change under the Inflation Reduction Act. So that's another thing. It should be easier for folks to access recommended vaccines through their Part D prescription drug plan.
Medigap versus Medicare Advantage. What are the pros and cons in this?
So Medigap works with original Medicare to fill the gaps in that coverage. You mentioned the change with Part A and some higher expenses that folks would have to pay on an inpatient hospital visit going into 2024. Well, how do you fill those gaps in Medicare? Well, some folks have retiree coverage through a former employer or union. Some folks may qualify for low-income assistance through Medicaid or what we call a Medicare savings program. But some folks, if they don't have that or they're not eligible for those programs, they can purchase a Medigap plan to fill the gaps in original Medicare. Some folks choose to get their Medicare a different way through a private health insurance company called a Medicare Advantage plan. There's no real Medigap that works with that, but the nice thing about Medicare Advantage plans is that they do have a maximum out-of-pocket protection. Mm-hmm. Original Medicare doesn't have that. You can get it with a Medigap plan if you pay for that, but
Now,
you know,
how much do you pay for it?
it really depends from state to state, but it, could be, $150 a month, could be a couple $100 a month, or even more depending on which plan. We recommend that folks research the options in their area in terms of the Medigap plans. If you look at the back cover on your Medicare handbook, we send every beneficiary every year. It's a red, white, and blue book. We send it in the mail. That has the number for a local counseling program that can help you compare the Medigap plans and other coverage options in your area. Or you can call 1-800-Medicare and they can refer you for the same assistance, because they vary a lot in terms of price. Now, with Medicare Advantage plans, sometimes there also is an additional premium, but some of those plans are available without a premium or with a very low premium, and they do offer a maximum out-of-pocket protection. So there are some folks, if they look at the Medigaps, they can't afford or don't want to pay that price for a supplement. They may choose to get a Medicare Advantage plan. That will protect them from high out-of-pocket costs because they'll have that maximum out-of-pocket protection. However, they will have to pay something. There's no Medigap that will really fill that gap in the Medicare Advantage coverage. But a lot of people sign up for Medicare Advantage, one, because sometimes they have lower premiums. Sometimes there are additional benefits. Most of the time, there are additional benefits that they cover, and that varies from plan to plan. But a lot of them do offer vision services, dental services, sometimes wellness benefits, and sometimes other benefits. So it's worth checking out if you're interested what is available. The best time to do that is during our annual enrollment period, which runs from October 15th through December 7th of each year. Some folks may have used that annual enrollment period to sign up for a Medicare Advantage plan, and maybe they're not happy with the plan they signed up for. We have right now what's called the Medicare Advantage open enrollment period. It runs from January 1st through March 31st. So people, if maybe they signed up for a Medicare Advantage plan, they're not happy with it, they have a little buyer's remorse, they can go back to original Medicare, or they can switch to a different Medicare Advantage plan. That may be a plan they were signed up for before that they were happy with, or maybe just another one that interests them. Okay. And, those same counseling services I referenced can be helpful in that process, or calling 1-800-Medicare, because this is a great opportunity. If you have Medicare Advantage coverage and you're not happy with it, you want to check out something else, now's the time to do that until March 31st.
So depending on one's healthcare needs, either they can have the original Medicare plan, or they can take Medicare Advantage, and the enrollment is going on till March 31st of 2024 if they want to make any changes. Now, what happens if they want to switch from Medicare Advantage to Medigap? Is that also open till March 31st of this year?
Well, that really depends on the rules in each particular state, and also whether you're a new Medicare beneficiary or not. If you are new to the program and you were just trying out Medicare Advantage for the first time, and you want to switch to a Medigap program, you do have a limited period of time where you can make that change, and you're guaranteed the right to purchase Medigap coverage. Some states do allow you. Most of them are in the Northeast, northeastern U.S., but it does vary from state to state. There are some states that allow you to select Medigap coverage at any time, and they have what's called community rated coverage. Sometimes that means the premiums are a little higher, but it does give you that option of signing up for it at any time. There is a caveat, though, with that, which is a pre-existing condition can be excluded for a limited period of time in those states. So you have to check into what is the law in your state to know exactly how that's going to work.
I believe that over 20 million Americans have signed up for Obamacare. That is a record.
Yes, it's really exciting. So many folks have signed up for health insurance coverage during the most recent open enrollment period. That ended in most states. There are a few states with their own marketplaces where that is continuing. New York open enrollment is still open through the New York State of Health. In New Jersey, it extends through the end of the month. If you live in a state that has its own state-based marketplace, you should go to their website or give them a call and see if you're still able to enroll. But it is exciting to have this record level of enrollment. Folks should certainly look into still enrolling for health insurance coverage. In some cases, you may find that you qualify for another program, even a special enrollment period, even if open enrollment has closed in your state. But we're very excited to have so many folks having health insurance coverage right now.
You can enroll in Obamacare even if the enrollment period has expired?
Well, there may be, depending on your state's rules and also whether you might be eligible for a special enrollment. Let's say you just lost coverage, you moved, you may be eligible for a special enrollment period to add coverage. So it's always good to ask questions if you do need health insurance coverage. There are other resources out there for folks also who don't have health insurance coverage, even if they're not eligible to sign up. Folks should check out the website hrsa.gov, hrsa.gov. That provides information about where they can find what's called a federally qualified health center in their area. So they can go there and get basically care that's at a discounted rate. They charge on a sliding scale based on your income. So that's a great resource also for folks maybe who don't have health insurance coverage. You've contacted the marketplace in your state and you can't sign up right now or you're not eligible for anything. You still can get access to healthcare through your local federally qualified health center.
So that's hrsa.gov?
hrsa.gov. And they have a tool on there called Find Your Health Center, your local health center. And then you can be connected to care, even if you don't have insurance coverage.
I see. And that can be at any time of the year, or is there a specific enrollment period?
Any time of the year, absolutely. And they provide, in addition to discounted care, they also can provide discounted access to medications. And some health centers even provide dental services. So it is worth checking that out if you need access to healthcare or you know someone who's having trouble accessing healthcare.
People are traveling a lot more. They could be grandparents, they're visiting their grandchildren, or they're visiting their children. And what happens at that time with your coverage of your healthcare plan? Because you might just be in between and there's a fine print in your health insurance plan. How does that work out?
Well, it really can be important, I would say, to check with your plan before you travel. Ask them what coverage they offer. And you may be surprised in a positive way for folks who are traveling overseas. You do some research and some health plans will cover you overseas, sometimes even for non-emergency services. But some plans won't. And some plans will only, even if you're traveling within the United States, will only cover you for emergency services. With Medicare, there are some different rules depending on what kind of coverage you have. So with original Medicare, if you have Part A and Part B and you're not in a Medicare health plan, you can go anywhere within the United States and receive services. And if you have a Medigap, a supplement plan, that'll also work anywhere in the United States, even for services that aren't emergency services. If you have a Medicare health plan, a Medicare Advantage plan, it depends on your plan. They're only required to cover you within their service area, but many of them do offer coverage. First I say within your service area for non-emergency services. They are required to cover if you travel within the United States and you need an emergency service, they're required to cover you. But some of them go beyond that and offer coverage for non-emergency services. For some Medicare Advantage plans, that's only for certain areas of the country where they have a network of providers. For some of them, you may have to notify them in advance before you travel. So it's important to contact your plan before you go and find out the rules. You have to notify them in advance. How does it work? And that's particularly true with international travel. As I mentioned, there are some plans, some Medicare Advantage plans, some other private health plans that will cover you for certain services when you're traveling internationally, but they're not required to cover you. Original Medicare will not cover you when you're traveling internationally. If you are in the United States and you have an emergency and it's closer for you to get treatment in Mexico or Canada in that rare circumstance, then that could be covered. But if the incident happens when you're outside of the United States, it won't be covered by original Medicare. So, if you have original Medicare, you could look at one of those supplements we talked about, one of those Medigap plans. Some of them offer travel coverage or purchasing travel insurance. As I mentioned, there also are a few Medicare Advantage plans that cover that kind of travel as well. But it's important to know before you go what exactly your plan is going to cover, so you don't have a surprise, something you
It's
need.
very important to make an informed decision.
Sometimes bringing medications with you, bringing a supply, thinking through, are there things, because they may be harder for you to get when you're overseas. And also don't make assumptions about other countries and what's going to be covered or not covered. A lot of us hear about, oh, this country has national health insurance coverage, or we hear that healthcare in a particular country is not that expensive, according to the folks who live there. But that may not apply to you. You may have to pay more as someone who's visiting. You may have to be required to get insurance as someone who's visiting, or pay out of pocket at a higher rate than those who actually live in the country. So you have to see what policies apply to you as a visitor, not necessarily what applies to those who actually live there.
So travel comes with a price at a time. Sometimes, what are you going to do? Medicaid, now that is state regulated, and we're talking about Medicaid beneficiaries. Now, if they're moving from one city to the other or one state to the other, that gets a little complicated. And how do they work out the health insurance plan?
Yeah, as you mentioned, Medicaid is, even though it's federally funded, it is a state-by-state program. So one thing you have to be aware of if you're moving is that state Medicaid programs are different in different states. And you do have to, if you do move, you do have to sign up in the new state. You can't use the Medicaid from the other state that you used to live in. And so that's important for a number of reasons. One, while you're making that transition, you may not be able to access services in your new state. Generally, if you have an emergency, that'll be covered out of state, but it may be difficult to get that service billed, and you may have some responsibility for the payment. So it's important to be aware of that.
Well, how do you do it?
Non-emergency
services. Now you're traveling, let's say, from one state to the other, but in this transit, you get sick.
Yes.
And you don't have a plan either way. And that's
you have to check with your state's Medicaid program on the rules. Your provider in the state you're visiting may be able to bill your state's Medicaid program, but you really need to check before you travel what those rules are, because it does vary from state to state. But also, if you move, you have to be aware of the fact that coverage is different, and even eligibility can be different from state to state. So you may be eligible in one state, but you move to another state and you may not be eligible, even though your income is the same and your situation is similar. They may have different rules. You may also find that certain medical services that you took for granted as being covered in the state you're moving from may not be covered for you in the new state, because some Medicaid benefits are optional. So it's very important, if you have a serious health condition and you're thinking about moving, look into the situation in the state in which you're going to move and what you're going to be eligible for, what coverage is available. Can you access providers in that new area? Because in some states too, it may be, even some areas of certain states, it may be easier to access specialist care than it is in other places. And so, our coverage is really important to know about as we travel.
So that gets a little bit of a scary situation, especially somebody may have a a medical condition or may develop a medical condition, and they suddenly realize, like you said, their income is still the same, the circumstances are still the same, but yet the other state may not accept them and qualify them for Medicaid. So they may have to buy, can they buy Obamacare at that time?
They may be able to, but their situation may, in terms of what they would be eligible for, there are some states that have not expanded their Medicaid program under the Affordable Care Act. And so the situation about who is eligible for tax credits for purchasing coverage through the marketplace may be different. And so, you could find yourself in a situation where it's harder to get affordable coverage, even if you have to purchase it. So, it's really important to think about these things, particularly if you have a chronic health condition and you're moving. What is the situation? And a lot of, we were talking a little bit earlier about the fact that insurance is regulated differently from state to state. So even though there are some national rules under the Affordable Care Act, there's a lot of variation from state to state in those Medigap plans and how they work, but also in other health insurance. So when you move, there can be different situation in terms of how insurance coverage works. And that's something to be aware of. I know there are a lot of big considerations we have when we move, and health insurance maybe we think further down on the list. But if you do have a chronic health condition, not just your health insurance, but also access to providers who can help treat you that you're comfortable with, that can be an important consideration when you're moving.
Medicaid plans, you can change them in the year depending on whatever circumstances or whatever your decision may be. But once you have Medicare, you can pretty much change it. Medicaid,
well, folks with Medicaid, it really varies from state
option
to state. Now, if you have Medicaid or the Medicare Savings Program and you have Medicare, may change to your Medicare plan every quarter of the year. But in terms of your actual Medicaid plan, the plan you're getting through your state Medicaid program, the rules will vary from state to state, whether you're locked into a particular plan for an extended period of time or whether you can make a change more frequently. So that also can vary from state to state.
Oh, so that's another tough one. I thought that Medicaid, you don't get locked in that much as Medicare plans do. But again, it depends state to state.
So each state Medicaid program is different. Yes. So folks need to consult the rules of their local state program to see whether they can make it.
But Medicaid has more flexibility in terms of changing your plan.
Well, within the Medicare program, if you qualify for Medicaid or a Medicare savings program, for example, based on a lower income, qualify for extra help, you can change your plan more frequently under Medicare. And the Medicare plans are designed to work with your Medicaid. But many people just have Medicaid.
Right.
They don't have Medicare and Medicaid, or they may want to they may have a plan through Medicare and a Medicaid plan that they're trying to coordinate. So it is important to understand the rules of your local Medicaid program. Okay. Medicare does have a particular special enrollment period for folks who qualify for Medicaid and low income assistance, but that's a Medicare rule. So the Medicaid rules vary from state to state. Any
other changes that you see in 2024 from CMS?
Well, there's some regulations and rules that we've recently come out with. They won't take effect for a little while. They won't take effect this year. But the idea is to streamline the prior authorization process. A lot of folks do encounter challenges getting services approved through their health plans, and providers have those challenges as well, trying to get certain services approved for their patients. There can be a lot of different policies for different plans, and in some cases, folks are not given a reason when a prior authorization is denied about what they have to do, what documentation needs to be provided to get that approved. We recently came out with some new regulations that won't take effect this year, but will in the future, that will streamline the process, lead to faster approvals in urgent situations, or faster reviews, I should say, in urgent situations, and will require that folks be given a reason when a prior authorization is denied. And those rules apply to Medicaid and children's health insurance program plans, as well as plans through the marketplace. And they are those rules were passed to coordinate with some changes and improvements to the rules for Medicare Advantage plans to streamline their prior authorization rules. So that's, potentially a big improvement, because I know a lot of folks have struggled, and a lot of healthcare providers, clinicians have struggled with the prior authorization process and the differing rules with different plans. So hopefully those rules to streamline that process will be a big help in the future.
Well, thank you very much, Frank Winter from Center for Medicare and Medicaid Services. I'm Dr. Renee Mehrra. Stay healthy, stay positive.